I recently had a chance to meet a doctor and inventor who's been getting a lot of attention lately. Dr. Evelyn has created a mat that has been clinically proven to alleviate a whole slew of physical problems, from back pain to jaw pain, and the list goes on and on. The doctor dropped by the studio and I had a chance to try it out myself. Take a look.
It's a do-it-yourself system. It decompresses and realigns, and it does everything at once. It aligns the jaw, the entire spine, brings the shoulders back, restores the normal curves. In fact, that's my initial invention, was to restore our normal curves. Unfortunately, in our modern society, everything we're doing is in front of us. Right. So, and especially even the young people now, they call it forward head posture is running rampant. Mm-hmm. And they're finding not only is it unattractive, it causes headaches, causes jaw problems. In fact, you could even test yourself. If you sit upright and you notice your jaw, it's nice and relaxed. If you bend your head forward, you feel the pressure on the jaw.
That's a very good point.
Yes.
So tell me a little bit about how you created this, because you kind of made a makeshift model first, right?
Yes, I did. We called it the Amish model, and we made them in small, medium, and large, and people would lie on them, and we had amazing results. In fact, I didn't know all the things it was going to affect. In fact, the face piece, I didn't know it's going to align the jaw. I wanted, out of vanity, not only did it not cause wrinkles, which the first 6 did. Can't have that.
Oh, right.
So when I redesigned it, not only it didn't make wrinkles, it did a little passive facelift. It does the opposite of what gravity is doing to us here too. Here we use gravity for good on many levels.
So let's have your husband lay down in it real quick. And this is pretty easy, does it, isn't it?
Very easy to do. You can customize it to all sizes. It is clinical grade, assembled in America, 100% guaranteed. You have 100% money back guaranteed.
And you're a chiropractor, and you actually use this in your practice as well, right?
That's right. In Illinois, where I'm a chiropractor, I can bill this. It's a covered modality as neuromuscular reeducation or non-mechanical traction. And the most amazing thing for me was that I fixed myself. I was in a severe flying through the air car accident in my college years. So I used to chronically adjust my own neck for migraines, and I had a horrible disc in my lower back. In fact, on x-ray, when you looked at the side view, there was like nothing, and now it's big and juicy from using this system.
And that's a very good point, too, because in general, too, aren't our backs as we age supposed to just get worse? I mean, we're going to break down in general, aren't we?
Too bad. That is the case. I mean, we need gravity, but it also is painful to us. And unfortunately, we do have a tendency as we get older to bend forward. That's uneven weight bearing on the discs, puts pressure on the discs and the nerves. The muscles react. You get trigger points. Arthritic spurring occurs. This undoes what gravity and, unfortunately, bad posture does to us.
And I had a chance to try it earlier, and I have to say I feel so relaxed now. You know, in general, when do you suggest people lay down in it?
You can do it any time of day. Our joke is a man can do it any time. A woman must do it first thing in the morning or when she goes to bed. Sometimes when I don't have time to do my system, I have it right next to the bed. I'll go to bed on it. And the nice thing is I can't overdo it. Sometimes we actually prescribe 20 minutes a day at first. Once you're perfect, you can cut back the frequency. Sometimes I'm on it 2.5 hours. I think, cool, you know, great. And then I go right from the system to the bed.
And you have athletes use this, and you have older folks use it as well, right?
That's right.
Tell me a little bit about that and the response so far, because you even had a 90-year-old woman on it, right?
That's right. My oldest patient, she took the longest to get well, but she was a trooper. She kept using the system, and indeed, after about a little over half a year, it seemed kind of like you flipped a switch. All of a sudden, she went from being bent over to being upright, and she started popping when I aligned her. You know, we call that audible releases. This older lady hadn't had an audible release in 15 years. She started, because we improved her limberness, but she had to earn it. And indeed, she did use it every day. Eventually, her twin sister had to get one because she was jealous, you know. And now she's 95 and bragging to me on her birthday. She was on her bicycle. You know, when you leaning forward, you lose balance. So that can make it hard to bicycle.
And this has been pretty exciting because this has been featured on the doctors. I mean, this has become a big deal. You know, that's really neat that you helped create something that so many people are using.
Thank you. It's quite an honor. But it also is an arduous task to bring something so new, and it works so well. I know it almost is unbelievable. You really have to feel it to believe it, we say.
That's a very good point, and it's pretty easy to use too. You get directions on the website. You know, folks can figure it out based on height, weight. You know, in general, you can put it on the floor. You can start it on the bed. I mean, there's a lot of ways to do this.
That's right, and it only weighs 10 pounds, so it's easy to take with you even in travel.
So basically, it's a money-back guarantee, so folks can just pick it up and try it and love it, right?
That's right. If you use it, you're going to love it.
And if you'd like to try the True Align Body System yourself, and you can get a discount if you put in LHOV 350, you can give them a call at 855-522-3542. Also online, fixyourachingback.com.